Well, hello, everyone. My name is Fred Horn, and I'm speaking to you from Edmonton, Alberta today. It's my pleasure to serve as moderator for today's webinar. I'm pleased to be here in my capacity as Senior Advisor at 360 Public Affairs in Ottawa. And you may also know me as a Canadian Health Policy Consultant and a few years back now, a former Minister of Health in the province of Alberta. Today we're going to be discussing a subject that's near and dear to all of our hearts, and that is a rare disease strategy for Canada. And in the case of today's webinar, we're going to be talking about it in a provincial context as well, in Ontario. The report that is the basis for the webinar was recently released by Life Sciences Ontario. It's called Cast Our Pebble into the Pond: How Adopting a Provincial Rare Diseases Strategy Would Save Lives and Boost Ontario's Economy. And I highly recommend it as reading to you if you have not had an opportunity to take a look at it yet. It's a very fresh look on arguably one of the most important issues facing Canadian healthcare today. But it also builds on a lot of the work that has been done over the last few years by many of the people who will be on this call in terms of building that foundation to make, as I like to say, to make rare disease part of mainstream healthcare policy and service delivery in this country. Our panelists today are very distinguished colleagues. You'll know many of them. First, Jason Field, President and CEO of Life Sciences Ontario. We'll also be joined today by Durhan Wong-Rieger, President and CEO of the Canadian Organization for Rare Disorders, Bob McClay, General Manager of SOBI Canada, Beth Vanstone, a caregiver and rare disease advocate, and the Director of CF Get Loud. And finally, this individual will be wrapping up the webinar today, Carrie Mcelroy, from Sanofi Canada, the interim general manager, and also the Canadian country lead for Sanofi Genzyme and Sanofi Canada. So welcome to all of our panelists. Thank you very much for taking the opportunity to be here. We have an hour to work with. We're going to begin with an overview of the report. Jason will provide that to us. And then we're going to ask three of our panelists to provide in a nutshell, their first reaction to the report. And that'll be about 5 minutes for each panelist. And then we'll launch into a question and answer period where we get you involved. I'm prepared to kick it off with a few questions, but we're looking forward to having the panelists question and respond to one another. And then finally, as I said, Carrie Mcelroy will wrap things up with her final thoughts about the vision paper and some food for thought to help move us forward. So with that, I'd like to turn it over to Jason to provide a short presentation. He's going to talk about how this paper came together and give us some of the key insights and recommendations. Jason, over to you.
Well, thanks, Fred. I really appreciate that. And just for all of the participants, as you formulate questions, feel free to type those into the Q&A box or the chat function, and Brian will put them over to the Q&A box for Fred to take a look at and pose those to all of us that are participating. LSO is very proud to publish this new paper on how a provincial rare disease strategy can improve the lives of patients as well as boost our innovative economy. We've titled this report, Cast Our Pebble into the Pond, because we know in order to achieve this very ambitious vision, we need to start now with small but important decisions. In the report, there's a terrific story of the City Council vote back in 1977 in Cambridge, Massachusetts. That was a precursor to the amazing biotechnology giant that is the greater Boston area today. But it took a unique confluence of events in order for that vote to take place. Indeed, timing is everything. And I think that right now we have a unique window of opportunity. COVID-19 has certainly changed so much in the life sciences landscape. Public awareness of our sector is at an all-time high. Partnership and collaboration between academic, research, industry, healthcare, and government has never been stronger. And we also have a federal commitment of $500 million towards the development of a Canadian rare disease framework. So indeed, now is the time to cast our pebble into the pond. Next slide, please. Our hope is that the tiny ripples from that pebble will grow to become this ultimate vision by 2040, where life sciences is an economic engine for Ontario. Health innovation is considered an investment rather than a cost. And we have systems in place for prevention, for early diagnosis, and the best innovative treatments available for patients in a timely manner. This is a bold vision, but we think it's attainable. The key to success, though, is starting now, prioritizing rare disease as part of our health and economic strategies going forward. Next slide, please. As Fred pointed out, there's a lot of work that went into this report, and it really builds on many of the reports that came before. It is a focus around an Ontario strategy. I'm not going to go through in detail the whole report, but I want to highlight the 5 pillars, strategic pillars that we identified, and give you a little bit of a flavor of what they could mean. So the first pillar we identified was to build a workable system for patients that is driven by facts and data. The system for rare disease treatments needs to be attuned to the needs of and workable for all players. This includes patients, governments, the health system, researchers, and their institutions, as well as industry. Our second strategic pillar is a clear, efficient, and patient-friendly regulatory system. Treatments for rare disease require separate and tailored systems and rules for clinical evaluation, regulatory approval, emergency drug access, health technology assessment, and access processes that put prompt but safe access to patients as the #1 priority. Rare disease treatments need their own set of rules rather than being forced to fit into a system not created or suitable for them. Strategic pillar #3, accelerated funding for rare diseases, diagnosis, treatments, and care. The health system must be structured and resourced to provide patients with better access to testing and diagnosis services, the best treatments that might help them, and supportive care and services that can alleviate suffering and uncertainty. Our fourth strategic pillar is make managing rare diseases an economic development strategy, not just a health strategy. Spending on healthcare and rare diseases in particular needs to be seen not just as a cost to be borne grudgingly, but rather as an investment that is a key tool for economic development, contributing to health as to better health. Our fifth and final strategic pillar is to integrate Ontario's rare disease strategy with other health initiatives and the Canadian rare disease strategy. Ontario cannot act alone or in isolation. Its rare diseases strategy must fit seamlessly with national programs, as well as initiatives to address other major health challenges, such as cancer and public health protection measures. Next slide, please. Finally, I want to acknowledge that this report builds upon the amazing work from organizations like CORD and their seminal rare diseases strategy from 2015. Certainly, Durhan, who's with us here today, has been absolutely tireless in her work and is an inspiration for us all. As our patient advocates like Beth Vanstone, again, who's also here with us today, as well as industry leaders like Bob and Carrie, who again have been advocating for systems that work for everyone and ensure that patients get access to these medicines in a timely manner. So it's collective work like this that has really led to the federal commitment of resources towards a rare disease framework. And we had some great news this morning as well from Ontario, where they have finally listed Trikafta and made it available for cystic fibrosis patients here in the province of Ontario. It's a prime example as to how the pathway to getting innovation into the hands of those that need it the most is best achieved through negotiation versus blunt instrument regulation. This is great news for Ontario, But now we need the province to take the next step to ensure that all rare disease patients will have access to the innovations that they need when they need them. We need the provinces, and starting with Ontario in this case, and this is the focus of this report, we need Ontario to take a leadership role in prioritizing rare diseases as part of its future health systems, as well as achieving economic prosperity. Thank you very much, and back to you, Fred.
Thanks very much, Jason, for the overview. I'll just remind our audience that you can post questions in the chat box. I have it open here. I'm going to be keeping an eye on it as we go through the rest of the hour. Next, we're going to turn to three of our panelists to provide their take on the report. And to start, I'd like to call on Durhan Wanreger for her comments on the vision paper. Over to you, Durhan.
Thank you very much. And I'm sorry for joining in just a bit late. Good thing I read the vision paper well ahead of time. So I really appreciate it very much. And of course, you know, we've been really working with Life Sciences Ontario over the years in terms of the development of not only the strategy, but also really looking closely in terms of how do we actually advance on rare diseases. So we are just really so very, very pleased to see this come together as a strategic direction. And it really is a blueprint. I mean, when we first proposed the rare disease strategy, we really recognized the fact that all of these areas, as Jason has said, were interrelated. And that if you want to have optimal rare disease, not only care and treatment, but if you want to really advance rare diseases, you do have to be focused on research, because research is what is the underpinnings of it all. We need research in order to advance the diagnostics and being able to make sure that not only are we delivering on, you know, the up-to-date and the diagnostics, but that we're actually able to collect that information and then make meaningful use of it. And, you know, frankly, between 2015 and where we are now, you know, some 6 years later, the science has advanced so far. What we imagined in 2015 was that, oh, well, we could have newborn screening and we could screen for 25 diseases and off we would go. Now what we know is that with the genomic sequencing and with the next generation sequencing as well, and exome sequencing, we could probably diagnose almost every single rare disease there is and use that powerfully. And Canada could actually have access to that information to help us advance the science and to use that science. And I guess that's why we appreciate so very much what this blueprint is all about. As we're advancing, let's just take genomics, and genetics as that. We're collecting that information, building the database, that we're able to wrap that into the research. And we have some of the most amazing researchers in the area of genomics, in the world. I mean, I just had a call last week with one of the companies that's actually doing the work, groundbreaking work. And they say, can we come up and meet with your scientists? Because we know what's happening there. We've had spin-off, companies that are actually being able to do gene therapies based on the work that they're doing in the laboratories. And that's even without the significant kinds of funding that should be made available to them. So, we see, I think, what's being presented here is absolutely an amazing opportunity for Canada to get out of what happened way back in, I don't know what year it was, Fred, 1995 almost, when, Canada looked up and said, no, we don't need an orphan drugs, strategy. The US is doing all that research. We'll just buy the therapies. And that was actually it. I mean, oh my gosh, we're a long ways from that. And we've been able to move forward, in spite of that. So I think what we are very, very excited about is the opportunity to help, move this forward, to embrace this in what we're doing now. And certainly, as you know, the federal government making a commitment to having an orphan drug strategy. What we have said over and over again from court, we cannot just have a standalone drug strategy. That drug strategy has to be embedded in a rare disease strategy, and a huge component of that strategy has got to be investment in research and development. And I say it now, as I said it before, I do not need $500 million a year to pay for drugs. What I need is $500 million a year to invest in infrastructure. We need to make this an investment area, because that will pay us back. So very excited to see this. It absolutely raises it. And I agree with Jason very much. Ontario was the first province to step forward when we introduced that strategy in 2015 to say, hey, we could do rare disease here. We can set up a framework. And we would like to call upon them to be able to pick that up and move forward with it. And this blueprint that is coming here, I think, is exactly what we need to make that happen. So thank you very much, I think, to LSO for all that you've been doing in terms of putting this forward. And I look forward to how we can work together.
Thank you, Durhan. And ladies and gentlemen, you'll see in the chat window there, Brian Craig, who's handling the technical side of this for us, has just posted a link to the report. So if you haven't had a chance to look at it or to download it yet, it's there. And I do have to say, one of the things that impressed me so much about this new report is the extent to which it builds on a lot of the concepts and consultation and solid policy thought that went into the cord rare disease strategy in 2015. It's refreshing to see a new report in Canada in health policy that doesn't start us from zero, as if we've never thought about it. So kudos to both organizations. So Bob McClay, I'd like to turn to you now for your reaction to the report. I understand you're going to be giving us more of an innovator's perspective on some of the challenges related to research and development and deployment of treatments, but I also understand you've got some thoughts around economic benefits and improved patient outcomes that can come as a result of a provincial strategy.
Sure. Thanks, Fred. Nice to see a lot of familiar faces, a lot of passionate faces. Always a great. It's always great to be involved with this group and keep the dialogue going. I've been at this now for getting on 6 years in rare disease. I met Durhan early on, and was really captivated by her passion for helping patients, and this underserved, maybe not well respected group. It's difficult for this group of people. People who have rare diseases, families, they really suffer, and those that get involved in this see that and really want to help. But and I always say, people in Canada, we take great pride in our healthcare system, as we should. I think if Canadians realized how rare disease patients were treated, they'd be mortified. So, we have to continue to get the word out, continue to push for rare disease strategies and getting, innovative treatments to the patients that need them. Talking about economic value, I report into Boston. So I go down to Boston, well, before the pandemic, I was down in Boston almost weekly. And, just seeing the number of cranes, the number of new buildings, the number of conferences and the investment that's happening there in the life science sector is quite remarkable. And to emulate that here in Canada and Ontario would be great. And that is all just stimulated by investment, by an open and willing market that can feed into that. As a rare disease company in Canada, when I first started, I met with some folks, and they said it's tough to run a rare disease company in Canada. You've got to fight for every patient. And it's not easy. You're not going to be a star on the global stage as a GM of a Canadian rare disease company. And I really found that to be true. We do have to fight for every patient. There's always that gap between, when the research happens, when the product's approved, even if you do research here, then what happens? Once the product goes into, once the study's over, goes into the regulatory approval process, there's a time gap there. And who's paying for the drug? Is the patient going to continue to get the drug? And oftentimes, that's a very stressful moment for clinicians, for patients, for families, because they're not sure. We acquired a new product recently where there were some studies that were done in Canada. And before the ink was even dry on the deal, the head of the advocacy group for that product was calling me saying, are you going to continue to pay for the drug? The old company was, are you going to? So we would get put in situations that are very difficult and stressful for patients. We're asked to do things, make decisions on who's getting treatment, who's not getting treatment. And it puts a lot of people in a tough situation. I'm not really sure that anyone wants to really be in that position where you're, playing God with people's lives. And I don't think that's fair. I think we need policies and systems in place where patients are at the center. And that's one thing I like about this report is, the very first pillar, build a workable system for patients that's driven by facts and data. And I think putting patients first, or putting patients in the center, is always the right thing to do. So, I think, again, running a company here, you always want to have research done here. I think that feeds into Canadian investment in research and development. As Durhan said, we've got, world-class hospitals and clinicians. And I think that gains valuable experience for those physicians with these new treatments. It gets patients into the system, into the clinical trials when there's that unmet medical need. So we do our best to put as much research in as we can. But sometimes it's hard. Sometimes, I deal at the global level, and oftentimes we're battling for resources for Canada. And if it's a hostile environment here, or an environment where it's very difficult to get products through, it's very difficult to get products listed and reimbursed. The timelines are 6 months, 18 months, 24 months sometimes before a product can get listed. I have to fight against other jurisdictions around the world to get those resources, and sometimes it's difficult if the environment here is not viable. And certainly for rare disease, we found big challenges in that. So, I love the idea of the paper, and I think it was very well written. So hopefully we can get some traction.
Okay, thank you, Bob. And Beth, I want to turn to you now for what is arguably the most important perspective or reaction of all, and that is first and foremost as a caregiver and someone whose family has been directly affected by rare disease. What would you like to see in a provincial rare disease strategy, and to what extent does this report speak to your vision?
Well, this was very exciting to see. This is an amazing paper. And I remember back in 2015 when the work was starting and the foundation was being laid for this. When the first modulator for cystic fibrosis came out in, I believe, 2012, it was approved in 2012. And we started, my daughter and I began the fight to access that drug as she was suffering from cystic fibrosis and had been very, very ill. That was when all of the issues surrounding rare disease and drug access came to light for me. And I can't tell you as a caregiver how difficult it is to not only care for somebody that's that sick and facing, death, facing weeks and weeks in the hospital, care for a family, care for other children, and then have to fight your government to have access to a life-saving drug. It's a really heavy, heavy load to carry. And sadly, across Canada and Ontario, many patients are in that position where they're not only caring and trying to keep, family members alive, but fighting for what should be, a simple yes. We need to put patients in the middle. So this is amazing, and it's something that's much needed. And I think collaboration is always the best resource. And when my daughter Maddie was first diagnosed with cystic fibrosis, I became an advocate in order to be part of a solution. I wanted to work towards making things better. We fundraised, we participated in research studies. We did everything to get to the point where there was this drug. So to get to that point and then realize that access wasn't as easy as we might have thought was just heart-wrenching. Since that time, I've been advocating for CF modulators for nearly a decade now. The most recent was just funded, actually it was Friday that it was listed in Ontario, but that was a 2-year struggle. A struggle that our patients, many dying, many died, many waiting double lung transplants, many that had double lung transplants, well, they looked to the south of us and saw that drug being funded and given to patients in a mere 90 days. Our patients watched as people came out of their beds and got back to work. Well, we waited and had to fight at the federal level due to the PMPRB uncertainty that was causing not only the manufacturer of this modulator, but many others hesitancy in submitting to Canada. That's not okay. And that's not a fight that's meant for caregivers. I'm not a scientist. I am a mom that had to learn a lot more than I ever cared to know about a system that is so flawed that we need this system to help move things along. I remember speaking with Durhan many, many years ago about a pathway for orphan drugs. That was the term back in the day, orphan drugs. And they definitely need to come a separate pathway. And I think Ontario needs to be part of the solution for that. And quite frankly, I've had many meetings with our current Minister of Health, and she understands. She walked the walk with us when she was actually a health critic at the time when we fought for the first modulator. She understands, we've met with her several times since, that we need a separate pathway. And I quite frankly think that the time is now. I think that with COVID, as we've seen, this can be done. The recent modulator had CADIS report completed and submitted a week ago Thursday. The drug was listed on the Friday. The price listing agreement was done on the Friday. That's unheard of, but that just shows you it can be done when there's a willingness. There was a lot of pressure put behind that so that there was an urgency to get that done. A week later, it was added to the Formulary Ontario. All these things show me that when there's a willingness, these things can be done. I think that it's important that we keep patients at the center of this and that we work together for collaboration, and instead of battling back and forth, people need to be the center of it. And I'm really excited about this. And I think this can be a big change in Ontario. And I hope that we can lead the country in getting this going. Thank you.
Thank you, Beth. That's hugely helpful in launching us now into an opportunity for some Q&A. I'll just mention I am not seeing audience questions in the chat, and so to my colleagues in Ottawa, it may be that the chat here is that I'm in is restricted just to panelists. So if you want to do some copy and pasting, that would help me out a lot in case I'm missing out here. So I'm going to kind of go around the virtual table here, and I have a few ideas for things that I thought this audience in particular might be interested in. Jason, I'm going to start with you, and I mean, you know, at a really high level, I guess I'd like to hear you talk a little bit more about what you're hoping to achieve with the vision paper. I'd invite you maybe to talk a bit about why you chose the provincial strategy focus as well. Most of the work in the past has been at a pan-Canadian or a national level, you know, led by CORD in many cases, but supported by all kinds of provincial organizations. But this is the first time we've really seen a strategy targeted at a province, at a provincial government. So wondered if you could talk about that for a minute.
Sure, Fred. And just a heads up that the questions are being directed to the Q&A function, which is separate from the chat. I don't know if you can see that. But I'll let you take a look for that and see if you can find that. If not, Brian will help you out via chat. To answer your question about what we hope to achieve, I'm going to go back to your comments, Fred, that really identified that this work obviously builds on a lot of work that preceded it, in particular the 2015 strategy by CORD. Our expectation isn't that everybody's going to say, "Oh wow, this is great new, like, you know, information that's so enlightening by LSO, and now it's going to trigger action to take place." That wasn't the goal here. You know, what we wanted to do is to take the information and the work that's been done in past, and we wanted to bring it up to date at a time, and this is what we were talking about in terms of the opportunity, at a time when we have a unique window of opportunity. There is more understanding about what it means to wait for a treatment, right? Think about as we were waiting for COVID-19 vaccines. This is something that now every day people are starting to understand, you know, the kind of anxiety, and that's just a taste of what rare disease patients live through every day. And we just got a flavor of it, but at least there's a certain level of awareness now within the general public of the importance of this industry and the innovative products that we can bring to bear, and how important health is to economic prosperity as well. So we've got public awareness growing. We've got political will and engagement, recognizing that we can't solve wicked health problems in isolation. It really takes collaboration, right? And we've seen that throughout the COVID-19 pandemic. So one of the big drivers of this report is actually timing and opportunity. So we wanted to make sure that this is at the forefront of policymakers' thought processes as they're prioritizing the future implementation of health systems post-pandemic. And now is the time to act, right? It is an opportunity, but we need to start that process now in order to achieve the goals that we're setting out. Second part of your question is really why the provincial focus versus a federal focus. Well, we have seen a commitment around the development of a federal strategy, and a lot of the work has been directed at a federal level already. But health is delivered by provinces, and we need the provinces to prioritize rare disease as part of their health strategies going forward. Beth spoke about Minister Elliott, and in all of our discussions as well, certainly the minister has demonstrated an interest in rare disease. She's certainly a compassionate leader and very, I would say, sensitive to the needs of patients. There's an interest there, but we need provincial leadership as well. And Ontario is so well poised to do that. We are the largest province in this nation. We have influence, and I would encourage all provinces to think about what they need in order to deliver a rare disease strategy within the context of that federal framework. So now's the time to think about it, because we've got that federal commitment. And as we go into, this era of that post-election period, now that we've got some certainty around that, it's time to put pen to paper in terms of figuring out what we can do together within that federal framework and where the rubber hits the road at the provincial level.
Okay, thanks, Jason. That's an excellent segue into what I wanted to ask Durhan about now. So we've just come through a federal election, and as you're acknowledging, ultimately Canadians will benefit from this only through, good federal provincial work together. Durhan, I just wondered if you could talk a bit about what you see happening at the federal level now in the post-election period, and to what extent do you think a provincial strategy, which is now released, it's now on the table for people to read and contemplate, to what extent can that be complementary, or should it be seen as complementary by the federal government?
Yeah, and I really appreciate what you're saying, Fred, and certainly what Jason was talking about, because obviously, Canada's a federated, country. And so we do rely on the provinces in terms of, providing certainly the health system, the health resources, et cetera. What I really feel is so important about this moment, and I think what Jason's saying and what you've said, timing is everything, right? And what we have the opportunity to do, and what I think, hopefully what the federal, strategy and the federal approach is saying, is that we can pivot from thinking about health and even thinking about drugs and care as being a cost center, but as an investment center, as something that actually gives back in terms of returning back to society, back to families, back to the economy, back to, into the workforce. All of those things that we have never properly taken care of. And I would say that, we use cost effectiveness, we use cost utility as measures for what it is that we're going to be able to finance. And so this is the time where I say to provinces, put your money where your mouth is then. If you really want to think about how we're going to get a return on investment for what we are expending in terms of delivery to what Beth is talking about and others are talking about, is that we need to look at the other side of the equation. But beyond that, we need to invest. And I think as Bob says, what is a better time than now to realize that if we invest, we not only get back, but we get back more and we develop. It's very clear. The United Nations even says we cannot expect to deliver on this, sustainable development goals of 2030 and 2050 unless we invest in the health of people. And in this case, investing in health also means investing in research, also means investing in industry, also means investing in, the clinical spaces that we have. So think of it as an investment. And I think this is what this, a document helps us do, is that we can reorient ourselves to thinking about, all of this as an investment. And I keep saying, we're no longer going to be funding drugs. We're going to be financing. We're going to be investing. And if we think about it that way, it really is a very, very different scope. But if we're going to do it, what we've heard, over and over again as patients is that's not cost effective, or we need to get to cost effectiveness. Well, this is the opportunity to really look hard at where that cost effectiveness is and how you get that return and use all the equations that are to your advantage. So we believe that, definitely the provinces and the feds have to work together on this. The feds provide, the framework. The feds can provide some of that seed funding, but the feds are not going to carry it. The provinces will, because that's where the return is going to come.
Thanks, Durhan. So thank you for the questions in the chat. I'm going to come to them. A lot of them have to deal with the question of implementation and next steps. So I want to make sure that we save time for that. But before we do, Bob, to you, just on this theme of investment and partnership, we've talked about provincial and federal governments working together. Any advice for us or any thoughts on the private sector's role that would ensure the success of either well, let's talk provincial, because that's what this report deals with. So what is the private sector's role? What is their contribution to ensuring that this strategy in Ontario is successful?
Yeah, I think certainly, we have to be partners. We have to be at the table having discussions, and we're all spokes in this wheel, and industry certainly is that. And, we have the ability to bring funding in to invest. But again, we need a place that's fertile, a place that you can invest in and watch things grow. I think the provincial jurisdiction is the right one, just based on that's where the rubber hits the road. That's where healthcare is delivered. So, sometimes we find, and I've found at the federal level, they can I'm not saying they hide behind things, but, they're not the ones delivering the healthcare. So if you talk to, Health Canada, CADF, PMPRB, they're not the ones that are in front of patients. They don't ever see patients. It's the doctor in Ontario who has to say, sorry, I can't get that funded. The ODB is not funding that drug. So there really is a rub or a pinch at the provincial level. So I think it's very clever to go there, help them, because this really will help them. They're Minister Elliott, again, if you have the conversations with her, she has compassion, but sometimes, CADF didn't approve it, or Health Canada didn't approve it, or there's a delay here, delay there. She doesn't control that. But if there's a policy at that provincial level where they maybe have more control, they can be better partners. I think that's going to help them. So it's a win-win for everyone. More investment in the province, a stronger life science sector. That's where healthcare is delivered. And even as we're writing position papers on that $500 million federally, how is that going to be allocated? It's the provinces that spend the money. Can they earmark it? How is that going to be doled out at a provincial level? Because the provinces are the ones that deliver the healthcare. So, lots of questions there. But yeah, the stronger you can be at the provincial level with policy, I think that's only going to be helpful. So I think well done to do it this way.
Yeah, I think what you're saying is really important, Bob, and it's more than structured consultation processes where industry's asked to fill out questionnaires or react to reports that already have fully developed recommendations. It really is about being true partners and recognizing that the investment pie that we're talking about here is not exclusively tax dollars. It's not exclusively from the public healthcare system. True investment represents the intellectual capital, the financial investment of industry. I mean, many other players go into creating the foundation that would allow us to do this or to do better. Beth, I'm going to turn to you, and I'm going to sort of combine this with one of the questions in the chat. Really wanted to get your take on what your advice would be to Minister Elliott in terms of this strategy. And as my colleague here, Bill, put it, and anybody else can feel to jump in, who actually needs to read this and take it up for implementation? Health ministers are an obvious audience, but who else needs to be reading this and taking it to heart? And as Bill says, whose bedside table does it need to land on? So I'm going to throw that to you, Beth, to start with.
Terrific. I think that patient advocates should be taking this up. Rare disease organizations should be taking it up and reading it. I think that I remember way back when in my first days in business, hearing from one of my superiors that do not come to me with a problem without a solution. And I think it's so key here that we're addressing a problem and bringing a solution that can be worked to help solve the issues that are surrounding rare disease and access to rare disease. So I think that it's an amazing start for all of this. And I would sit down and speak with Minister Elliott, who we have seen as a very caring individual and a very smart woman, and say, like, here's the beginning. Here's how we avoid what her and I and the CF community has experienced the last 10 years, and what the rest of the rare disease, and a lot of them not nearly as successful as we have been, despite the time. I think that she'd be very open, and I think all ministers would be open to sitting and hearing offers up of solutions and how we can all collaborate and get this done together, as opposed to just hammering at each other. So I think that's what I would say. I think everybody needs to read that, especially those of us that are in the fight. I think manufacturers need to read it as well, so that they know how they can bring to the table and to make things work better, because I think all together we want this to work, and we need to keep the patients at the center of all of this. So that would be my.
That's a I'd like to delve into that a little more and maybe invite some of the other panelists. You know, it's having been a provincial minister of health, it's not hard to imagine, you know, pretty much any health minister who knows their brief and who is talking and, most importantly, listening to stakeholders in the health system, seeing this as a major gap in Canada or in their province, and being supportive, and you know, feeling for the very real challenges and quite honestly, you know, suffering that's being faced by Canadians who don't get access. But I can tell you from experience, I mean, it's one thing to be the minister and to be supportive of a particular initiative. It's another to get your government, i.e. your cabinet colleagues around the table, to support a particular investment, because of course every dollar we spend in healthcare, our government is generally, you know, regarded as an opportunity cost, not to do something somewhere else, maybe in health, maybe in a different portfolio. So I'd like to maybe turn to you, Jason, just for a bit of analysis. So given that, you know, the apparent support that exists for this for Minister Elliott, your take on what roadblocks she might face or the government might face in trying to get this moving?
Yeah, Fred, and just before I answer that, I just want to build on Beth's comments about who this needs to get in front of, and I would add two that are related to your question. Number one is, of course, the Premier. This needs leadership from the very top, and we need this to be prioritized. And I would also say the public service as well. We've got a new Deputy Minister of Health in Ontario. She needs to read this and be up to speed on it, as well as the folks within the ministry who are putting forward, you know, and building policy within the government. So this really needs to be on, you know, on the bedside table of all of these individuals within the system, because it is a system that eventually is going to get us the solution that we're trying to obtain within this report. In terms of the roadblocks and the barriers, you know, many have already said, you know, our conversations with Minister Elliott have been extremely positive. So what's stopping this from going forward? And to be honest, I really think it's at this time a capacity issue. I think Ontario dealing with COVID-19, it has really, you know, encompassed everything that they've been doing within the Ministry of Health, and it's been very difficult to move forward some of the other initiatives, and even the ones that they have managed to move forward have really been, I would say, pushed along because of COVID. So when you think about Supply Ontario, for example, that was an initiative that, you know, was really put in place as a response to some of the lack of preparedness, pandemic preparedness, and the things that were in place following SARS. So I think what's really needed here is a prioritization exercise where the government has to view this as a priority and look at it, as we've already talked about, through a lens of investment, not just cost. And once we can get into that mindset, I think that we're going to be able to move something forward with the province. I think there's a lot of things in our favor that are going to help encourage that. As I said, it is a confluence of events happening all at once, But one of the things that I think might really be helpful is the tough negotiations that are going to happen between the provinces and the federal government around health transfers. And the way I would be thinking about that is that there's money allocated around a federal rare disease strategy. Why not incorporate rare diseases into the conversation about what we want to achieve for Canada's health systems? That needs to be part of that dialogue, but it is separate and requires a unique solution. But, you know, again, all of these things have to be working in harmony with one another and together. So there's a real opportunity of timing here.
Agreed. Thanks very much, Jason. One of the other questions in the chat, I think, is very germane to this, and it kind of follows on what Jason was just saying in terms of roadblocks. In other areas of health, at least in webinars and other discussions I've been involved with, there seems to be a fair bit of hope that the experience of COVID-19 in Canada will, and this is the questioner's term, unstick policy conversations and contribute to breaking down silos that allow us to, you know, to talk about policy in a different way that isn't tied to the individual funding buckets in a Ministry of Health budget, but really allows us to start speaking in an integrated way about policy and tying it specifically to measurable outcomes, both for patients and for the health system. So I'd like to get your take on that, Durhan. You know, do you think things have been unstuck a bit enough, and some silos have been broken down enough that we might have better success this time in moving this agenda forward?
Oh, good grief, Fred. You're the one that's always taught me how slowly government moves. So no, I do think that this is a huge opportunity, but as Beth says, we have to take advantage of it. You know, I will say is that we are where we are in terms of the rare disease strategy and the rare disease drug strategy, not because government came in and say, hey, let's open up the way and kind of let you into this. I mean, obviously there was a lot of support and certainly support for funding, at least around the drug strategy help, but there was no action. We're the ones that finally say, when are we going to act on this? And, you know, it's like, well, we got to get a new minister. We got to get this set up. We got to get this set up. And we basically said, no way, we're just going to move. And this is our strategy now going forward after this election. I'm not waiting for a new health minister. I'm not waiting for things. So I think we have to take advantage, as you say, of the unstuck to push things forward and to put proposals on the table and to get, quite frankly, that private sector and those other, you know, stakeholders, including the patients, to come forth and say, here are the proposals, here's the ideas, here's what we can move forward. Here's even some things we can do to get started, you know, without waiting for government. I think that's what our strategy has got to be. You know, go out there and dig a hole in the ground and start to plant some things and then bring it, you know, people to it. Because if we wait for government to take the lead, it ain't going to happen. So I see this report, you know, coming out, this document, as being that opportunity. It opens doors, but it opens the door for us to act and to put things forward. So I think what happened with COVID also is that it really forced the governments to listen much more to people. And, you know, and the fact is that we were doing science in real time and we were putting all this information out there and people were able to respond in real time, again, gave people a lot more power. So this, again, is what we realized. We have a lot more power to actually not only demand things, but to actually put some things into action. So I think it's a huge opportunity, but it does mean that, you know, we have to work, you know, outside of governments at times to kickstart some things and take advantage of every single thing that's offered to us.
Okay. Thanks, Durhan. That's a great assessment from an advocacy perspective, from the perspective of an organization that's developed a strategy and done a lot of this consultation. So I just want to carry this just one step further and turn to Bob and, you know, really ask Bob, what do you see in terms of your ability to establish true partnerships with provincial governments and, you know, with other players in the health system? Do you think COVID has changed the landscape at all? Do you think it opens up new opportunities that you didn't have before? Certainly the context for dialogue can be a lot different. But what do you see in terms of hope for the future?
Yeah, COVID was very fascinating, as a lay person or as an industry person, because we saw our government really scrambling. We saw other jurisdictions around the world doing well, getting vaccines, and Canada was way behind. And from an insider's perspective, I think they were scrambling. I think they didn't have relationships with industry. They'd been very anti-industry. So they were picking up the phone, calling AstraZeneca, Pfizer, I'm sure, trying to build relationships and establish some trust amongst each other. And, I don't think the industry was standoffish, but it was like, oh, now you call me. We've been trying to reach out to you for years, and now you need a favor. So let's work together. But, as much as we were behind the curve, then we accelerated beyond the curve and did very well. So that gives me great hope that, it doesn't take long to establish relationships and trust. And this was, an absolute public outcry, health crisis that we had to manage, and we worked really well together. I mean, I wasn't involved in it, anything that I did, but just in seeing it from an industry's perspective, that partnership developed very quickly. There was a sense of urgency, unmet medical need, and action happened. So, it's unfortunate that it had to take a global pandemic for that to happen, but hopefully they learned something from this, that, relationships are good. This is helpful. And, there was a lot of announcements of investment in manufacturing and other things, which, is good for the economy, good for life sciences in Canada. So I think, hopefully there's some lessons to be learned there. I'd like to see that, so there's momentum. I think even the public has in their mind, manufacturers, the drug industry, maybe they're not that bad. Maybe they're actually here for the best interest of people. Maybe they are helpful. I think drug companies are always perceived poorly by the public, but maybe now's a time where we have some momentum and some positive energy, and will be perceived a little bit differently for being very helpful. So yeah, there's momentum now. There's money on the table for rare disease. As Durhan said earlier, we've come so far in treatments and diagnosis. I remember being at a conference years ago in Boston where, it was incredible, all of the new treatments that were out there. The innovation was just astounding. And at the end of the thing, someone got up and said, you know what, we've got all this great innovation. We're moving mountains here when it comes to the science. We just haven't figured out a sustainable funding model. And we all know that. We all know that it's very expensive to create new therapies, new treatments, especially rare disease with so few patients. So we've got to come up with a funding model. And Durhan, I love your investment, your different ways of looking at this, but that's where open dialogue and not just fighting about sticker price. That's just a waste of everybody's time. We've done that for years, where no one understands. Even policymakers that I've dealt with, they don't even understand. And these are people that are making decisions. They don't know how to run a business. They don't know what it takes to get a product here. I've heard statements like, well, you can make some profit, but how much is enough? And that's what a way to look at things. It's way bigger than that. So getting to the table, having good open dialogue, finding new ways of doing things. This old way of going to conferences and hearing their side versus our side, and it just goes around in circles, and everyone makes their numbers look the best, but it's not very helpful. So we've done that too much and wasted too much time. So now I think let's strike while the iron's hot, while there's some momentum, while there's funding, while there's a public trust in governments and industry working together to save lives and find solutions. I think the timing of this is great. So let's keep pushing this.
Well said, Bob. Thanks a lot. We have about 6 minutes left, so I want to turn it over now for about 5 minutes, and then I'm going to go to Jason at the very end. But I want to turn it over to Carrie Mcelroy. Carrie, love to hear your final thoughts about the vision paper. Feel free to reflect on the discussion we've had here now, and over to you.
Great. Thanks so much, Fred. I'd first like to thank Jason, of course, and the team at LSO for their partnership and their leadership in Ontario, and more specifically to this much needed rare disease initiative. And thanks so much to all the people that have contributed to the paper. We feel this is the right recipe with the ingredients for success in the province. And my sincere thanks, of course, to our inspiring panelists today, Fred for moderating, Bob McClay from SOBI and the team at Rare Eye, Beth Fenstone for your continued patient advocacy and your amplified voice, and to Durhan and the dedicated team at CORD. And I'd be remiss if I didn't call out Durhan, who approached me almost 10 years ago to the week to join her and a rare group of rare disease patients to raise awareness around rare disease and a much needed strategy. And Durhan at that time led a hike to the Arctic Circle with a dozen patients and myself. And she demonstrated that with the right support, patients with rare disease can do just about anything. And it was an honor and a life-changing experience for me to better understand rare disease patients and their journey. But I naively thought at that time that a rare disease strategy would be upon us. And I certainly hope that 10 years from today, for rare disease patients' sake, that we're in a very different place moving forward. I've been so fortunate to be with Sanofi for the past 20 years, and Sanofi's a leader in developing and delivering solutions for rare disease patients. And we've been committed to developing win-win solutions for health systems and developers, clinicians, and patients. And we've worked really hard to sustain what is the largest and most consistent investment footprint in Canada from a global life sciences sector. And Sanofi has been in Canada for over 100 years. And during the next 5 years, we really hope to bring additional therapeutic innovations to rare disease patients in Canada. But I would say now it's up to the Ontario Ministry of Health, and I see them as leaders, as well as everyone on this webinar and the entire rare disease community to continue implementing the plan and building upon CORD's Canadian rare disease strategy, not only in Ontario, but across Canada. So I want to thank you all for supporting and committing to a better path forward and for this opportunity to close. So thanks, Fred. I'll turn it back to you.
Okay, thank you very much, Carrie. Much appreciated. So Jason, I'm going to turn to you just for the last couple of minutes. We've got two questions here. One is, and they're on the same theme. One is, what is the next step for this report? And then more eloquently, the same question was restated by someone else as, this is a big elephant for government and industry. What is the first bite? So I'm gonna hand that over to you.
Hopefully I have an answer for those, but from our perspective, the next step of this report is much along the lines of what Beth pointed out, which is this is a report meant for everyone that has an interest in rare disease and moving this forward. So we want this to be a tool that all can use and point to say the elements have all been spelled out. They're written clearly and concisely, and we just need to take action. So we are going to continue to get this paper in front of decision makers, thought leaders, policymakers, advocates, and we need your help. We need everyone that's attending the session that has an interest. Print this paper out, keep a copy of it in your portfolio as you're talking to different people. Direct them to this. It's available for free. It's available widely. This session is going to be made available too. So that's really what we need, is to continue to get it in front of people. So that's really the next step, is continuing to make sure people are aware of this and encourage them to act on it. And that takes me to the second part of your question, which is, what's the first bite of the elephant? That's where the action comes into place. And I really think it's as simple as making rare diseases a priority within our provincial health system and the future of Ontario, both from a health systems perspective as well as an economic prosperity perspective. So that's number one. We've got to make it a priority. Someone mentioned that the health system is overwhelmed with putting out fires. And I think I spoke to that a little bit about some of the barriers, right? The capacity issue. And, COVID has exposed a lot of deficiencies within our systems. So those are becoming very much a priority. And it's also created new challenges, mental health issues, long-term care facilities, surgical backlogs. I mean, these are all challenges that we need to start tackling now. So, but rare disease is really important. It's something that Carrie pointed out we've been talking about for a very long time. And if we want to achieve success in the next 10 years, now's the time we have to act. And we've seen the opportunity that's in front of us, so it needs to be part of that conversation. So that's really the first step, is make it a priority.
Thank you, Jason. So I see that we're at time. I'd like to, first of all, on behalf of Life Sciences Ontario, thank all of the panelists today. And also thank LSO for inviting me to serve as your moderator. I think we've heard a very rich discussion, and we've seen this issue that we all care about so much put forward in a new light in terms of the pillars that are cited in the report, and also presenting it in a way that's realizable and achievable at a provincial level, which is something that I think is quite refreshing, particularly when you think about how difficult it is to do anything in healthcare on a coordinated basis these days, no matter what the issue. Looking at the means and mechanisms that are open to provincial governments, building on the work that's been done by CORD and others, to actually make rare disease part of the mainstream long-term thinking in healthcare in a province, in a provincial health system, is a huge contribution to the debate. So I'd like to thank again all the panelists. Thank you to LSO. Thank you everyone in the audience who attended and listened today and submitted questions. Was a great pleasure, and we look forward to seeing real action taken on this report and other rare disease initiatives in short order. Thank you very much, and good day.
Thanks, Fred. Great job.